post-pandemic purge of the rolls. Yeah, believe it or not, yeah, they're purging people from the Medicaid rolls in a country that does not have universal health care. More than 1 million people are dropped from Medicaid as states start post-pandemic purge of the rolls. More than 1 million people have been dropped from Medicaid in the past couple of months as some states move swiftly. They don't move swiftly on anything else, but to kick people off healthcare, to halt healthcare coverage following the end of the coronavirus pandemic. Most got dropped for not filling out paperwork. As all of us should remember, under the pandemic or the height of the pandemic, you did not have to fill out that paperwork, and now people have to do that. I mean, the federal government declared that the COVID-19 emergency was over, for God's sake. So this is both rests with the federal government as well as the state governments. And this is a statement from a top Medicaid official. Pushing through things and rushing it will lead to eligible people, kids and families, losing coverage for some period of time, but they don't care about that. Already about 1.5 million people have been removed from Medicaid in more than 24 states that started the process. Florida has dropped several 100,000 people, by far the most among the states. So, Jordan, here we are.
Yeah, I mean, this is a problem that the Democrats ushered in. It was entirely preventable because they didn't fight against it. Very few, even progressive members of the House voted against it, or some just voted present. I mean, we just have to look in the mirror here. It's really frustrating because this is something just like the child tax credit. These are things that improve people's material conditions. You can then in 2024 run on how you bettered their lives with your party's action, your collective action, but you could have hypothetically. Unfortunately, now all of that money that families were getting, people who were living in the margins, people who had these checks coming monthly because that's what they did in response to the pandemic, or if they were on Medicaid, now what are you gonna do? On top of that, they're probably not, unless the Supreme Court surprises us, they're probably not going to get student debt forgiveness. What are you gonna run on about improving people's material conditions? You have higher gas prices, you have higher inflation, you have potentially stagnant wages. People, have been warning about a recession, who knows? But things aren't looking great. And you have presided for the past 4 years. What are you going to run on in 2024? Is it Trump is bad? Maybe people will forget. Maybe that won't be as effective. They've tried that the past couple of elections. It's been successful sometimes. One of the most successful midterms was in 2018 when they ran on healthcare. They ran on Trump and Republicans' attacks on the Affordable Care Act and ran on preserving people's healthcare. They could have gone one step further and said, and we will also fight for Medicare for all. So everybody has healthcare. They chose not to, but that was an effective strategy. I don't know what they're going to do in 2024, what their approach, their campaign's focus and theme is going to be, because unity, that general message isn't going to work in the immediate, you had that immediate aftermath of Trump in 2020. He's removed, he's deplatformed on some platforms. He's not getting the same attention that he used to. Sure, he's got these indictments. People on his side certainly aren't going to care. Who knows if moderates are going to care if really it just comes down to their pocketbooks? Because a lot of people, even though they didn't like how he did it, they liked Trump because of the tax credits in the immediate windfall they saw, not realizing that the tax cuts for individual filers had a sunset provision after 10 years, while the corporate cuts are permanent.
There it is, Jordan. You know what they're gonna run on? They're gonna run on, well, we're not as bad as the other guy. Democrats 2024. That's what they're running on. And just one more, people don't understand how serious this is. A mother talked to the Associated Press, and this is what she had to say. The eligibility determination have created headaches for Jennifer, a 28-year-old who was told in April that she no longer qualified for Medicaid because Arkansas had incorrectly determined her income was above the limit. She got that resolved, but was then told her 5-year-old son was being dropped from Medicaid because she had requested his cancellation. Something that never happened, she said. So you know what? It's mothers like her, fathers like her, families like her from across the country who are going to continue to be impacted by this heartless nonsense of stripping away swiftly health care from poor and working class people. This is part of the moral decay in the United States of America.